today's this side. November 11th. That side. Alright, so this is the back of your nose.
The nasopharynx there?
Yes, this will be the nasopharynx. This is part of the soft palate there.
Okay.
And then we're seeing how it touches.
Okay.
So I didn't do the test with the papa cock. Oh, you will see the mucus going on. And then it seems to be I'm not sure if that was present, so let's see before. Yeah, so it seems like that was not there. I think this is just like from, I think a side effect from radiation is just some tissue loss. Whether that's causing increased pain or not, it's hard to say. But it's
What? It's just a hole in my soft palate?
not the soft palate, the nasopharynx. So in the back of the nose. Yeah, there seems to be some loss of tissue here, so a little bit of a hole, essentially. Yes.
Is that a problem?
Does that present a problem? For infection?
Not necessarily. I mean, it's a problem because it may get bigger over time. You may get mucus trapped in there.
Yeah.
So perhaps you're already experiencing some mucus getting trapped there, and it's harder to get rid of it because it's in a different spot. I don't think it was noted on your MRI, but we can open the MRI again and see. It may light up on the PET scan if you're getting it today. If there's a little bit of inflammation around it, but not too much. I have seen
The PET scan
may
would
light up
find it?
potentially a bit.
Why?
It's not very sensitive,
Yeah.
right? So I'm not sure if it will pick that up. This is very small, but there seems to be some redness around it. So the PET scan picks up anything that is inflamed, active infection or tumors or things like that, right? Anything that is taking up a lot of glucose, they give you a radioactive glucose for that.
Right.
So because there's a little bit of inflammation around it, perhaps it would light up a little bit on the PET scan. But yeah, I think that's new because I don't really see it here. Now, when exactly it appears, hard to say. Is it really causing a problem at the moment? I'm not sure. It may be related, or it may be contributing to either their pain or the issues with the mucus, which, again, I don't think it's all of it that's going on, but perhaps some mucus is getting trapped and you feel like you cannot clear it.
I feel like I'll have a lot more infections, or I'll have to do antibiotics.
So we can check with your primary team, and I can review the MRI a little more closely with a different maybe neuroradiologist and check whether there's any evidence of like radiation-induced changes in the cartilage or the bones, osteoradio or osteochondral necrosis. Sometimes we do chronic antibiotics for that, probably to try to prevent something from getting worse. But it doesn't look acutely infected at the moment. All right, so now
Okay.
I think this has been stable, the opening, and I don't think it's narrower.
Yeah, that looks the same.
So that's good. Yeah. And then you've had this little this yellow thing in the side before. There. But I think that was just mucus. I don't see it. Yeah, so looks okay.
So that's gone.
Yeah, there's no.
Why is this so this color?
Well, this is a filter to highlight anything white or the vasculature. All right, and then we go back to the quartz.
That provarian is holding up so far. No?
There's probably some still there. It's not as good as immediately after.
Right.
But let's see when we.
I'm saying it was, what was it, 5 months ago? More.
Yeah, I'll have to double check the exact date. So you know you don't close perfectly, but there's not a huge gap. I think. You know, a good part of the voice changes are also just the fact that air is escaping through your nose when you're talking, right? Let's see. All right. Yeah, so I think not as good as immediately after, but you know, still getting pretty close together. You know, but not complete perfect closure at this point. All right.